Today we'll be talking about Methylmalonic Acidemia versus Propanaic Acidemia. So let's get started. Now, these two acidemias share a lot of similar symptoms. A patient who has either acidemia, which will always be a neonate, will have hyperammonia, metabolic acidosis with a high anion gap, so +10, failure to thrive, lethargy, seizures, hypotonia, vomiting, and a buildup of acid in their urine. And the acid is dependent on which acidemia it is. But these are all common symptoms that either acidemia will have. Now, to understand the differences between the two acidemias, we have to first understand this pathway on the left. The key thing to take away from this pathway is the order of products. So we have to remember propanayl-CoA, methylmalonyl-CoA, succinyl-CoA, and that's the order of products, and that's important to remember. Now that we know that, we can add a little bit of more information. So what this overall pathway is going to produce is energy for the Krebs cycle, so that the cell can use it. Now, the substrates that start this pathway are going to be several things. So odd-chain fatty acids, cholesterol, valine, threonine, methionine, isoleucine. And I like to remember these substrates by the mnemonic C-vomit. C-vomit stands for the first letter of all these things. I also remember C-vomit because vomiting, seeing a neonate vomit, is a symptom of both acidemias. So it's an easy way to remember what starts this pathway. Now that we understand the pathway as a whole, we can talk about problems we encounter in this pathway. So the first problem we can encounter is something called Propanaic Acidemia. Now, this is a problem that happens within that first step of the pathway. Meanwhile, Methylmalonic Acidemia is a problem that happens between the second and the third steps of that pathway. But let's go into more detail, starting off with Propanaic Acidemia. So that first step doesn't work because the enzyme there is deficient of working. That enzyme is propanyl-CoA carboxylase. You can also have this because if you have a deficiency of the cofactor, which the enzyme needs, and that's the cofactor there is vitamin B7. So either the enzyme or the cofactor being deficient will cause this acidemia. As a result of this enzyme not working, we're going to see increases in propanayl-CoA, but decreases in methylmalonyl-CoA. Now, before we contrast this to methylmalonic acidemia, I quickly want to fill in a bit of information in that pathway again. That second step, the enzyme that converts the second step is methylmalonyl-CoA epimerase, and it's relevant to the next acidemia we're going to discuss. Methylmalonic acidemia involves two enzymes. So if either the second or third steps and the enzymes involved in either don't work, it can cause this acidemia. So if methylmalonyl-CoA mutase or epimerase are deficient, this acidemia happens. Also, if the cofactor is deficient, which in this case is vitamin B12 is deficient, this acidemia can happen as well. In the case of this acidemia, because of where it takes place in the pathway, you're going to have increases in methylmalonic acid and in propanaic CoA. So the way I remember this is that methylmalonic is a longer word than propanaic, and because of that, there's more acid buildup. There's both acid buildup.